Hello, everyone. I'm Susan Anenberg. I'm going to spend a few minutes talking about why and how we did this study. And then you'll hear from me again towards the end of the webinar talking about the health impacts specifically. So next slide, please. The motivation for this study started with the growing recognition about the extensiveness of real-world diesel NOx emissions that were over certification limits. So there's growing recognition about the extent of excess, what we think of as excess diesel NOx emissions, that is everything that's over the laboratory emission limits. And you can see here a graph of the various car models in Europe and how much more they're emitting in terms of NOx emissions under real-world driving conditions compared with the laboratory emission limit. So this is a problem that is quite extensive within the passenger car market. And next slide, please. It also extends beyond passenger cars to trucks and buses as well. We have seen a number of in-use emission testing studies from the US and Europe, China, Japan, and elsewhere that show that this problem of excess diesel NOx extends to passenger cars and to trucks and buses. And these studies use a variety of means to monitor emissions in use. On the left, you see an image of portable emissions measurement systems, or PEMS, where the vehicle is loaded with emission measurement equipment, and then the vehicle is driven around the different types of driving conditions. Could be city streets or highways and various other driving conditions that are typically encountered under real-world conditions. On the right, you see roadside remote sensing, where monitors are set up next to the road, and as vehicles drive between the monitors pick up the emissions from individual vehicles. So using these variety of emission measurement techniques that measure emissions in real-world driving, we now have a sense for the real-world emissions from diesel cars, trucks, and buses around the world. Next slide, please. And as Ray mentioned, about 2/3 of all vehicles are designed to European emission specifications. So if we are seeing some gap in real-world driving emissions that are occurring even with European emission standards, the same situation is likely happening in other parts of the world that are also following European standards. And the same can be said about US and Canada. Any vehicles that are driving, diesel vehicles that are driving in these areas that are following current emission standards may be emitting more NOx under real-world driving conditions than is allowable under the emission limit. And so the motivation of our study is that the extent of the excess diesel NOx problem is quite large. It extends beyond cars to trucks and buses as well, and to likely all regions of the world. And there are real environmental and public health implications of this topic. Next slide, please. Just a little bit of background on what nitrogen oxides are. NOx is the combination of NO and NO2 that comes out of vehicle tailpipes. And NOx is a key precursor to outdoor air pollution. So it forms ground level ozone, which we often call smog, and it forms secondary fine particulate matter, which is often called PM2.5 or soot. So ozone is not emitted directly, and secondary fine particulate matter is not emitted directly, but is formed in the atmosphere in the presence of precursors. Nitrogen oxides are a key precursor to both ozone and particulate matter. So you'll hear me talking about PM2.5 frequently throughout the presentation today, and that refers to this secondary fine particulate matter. And both ozone and particulate matter exposure are linked to adverse health outcomes, including disability and years of life lost due to stroke, ischemic heart disease, chronic obstructive pulmonary disease, lung cancer, and lower respiratory infections. And these linkages are based on decades of epidemiological research linking ozone and PM2.5 to these various health outcomes. As a result, ozone and PM2.5 are two of the most highly regulated pollutants worldwide. They can also cause damage to crop yields and other vegetation like ecosystems. And you'll hear Lisa Emberson talk in more detail about that aspect. And nitrogen oxide also forms pollutants that affect the climate system in different ways. And Davin Henze will talk in greater detail about that. Next slide, please. We focused our study in terms of the health impact assessment on the most severe health outcome, which of course is premature death. But it's important to understand that there is a large variety of health outcomes resulting from exposure to air pollution that we did not quantify. That includes emergency room visits, hospital admissions, heart attacks, doctor visits, school absences, lost work days, even lung function decrements and inflammation. And you can see this cartoon here shows how the proportion of the population affected grows as for some of these less severe health outcomes. So the most severe health outcome that we quantified is just this, the tip of this pyramid here. Next slide, please. The health impacts of air pollution are really quite large on a global scale. In fact, it's one of the top 10, outdoor air pollution is one of the top 10 risk factors in all of the most populated countries of the world. The Global Burden of Disease study estimated about 4.5 million premature deaths from outdoor air pollution in 2015. And you can see here the spatial distribution of the estimated premature deaths from outdoor air pollution. Very large in China and in India, but some of the other countries, including the US and Europe, are also experiencing a large amount of premature deaths from outdoor air pollution. Next slide, please. So how does diesel NOx emissions contribute to this problem of the health impacts from outdoor air pollution? This is a figure from our study that puts the amount that diesels emit in terms of NOx in the context of all other anthropogenic NOx emissions. So on the left-hand side here, you see global anthropogenic NOx emissions, and on-road diesel NOx is just the green portion of that, but they produce over 20% of global anthropogenic NOx emissions. And then you can see here that we focused on 11 major vehicle markets representing over 80% of new diesel vehicle sales. And those 11 regions capture over half of the total global on-road diesel NOx emissions. Next slide, please. Our research questions were, what are the health, climate, and crop yield impacts of excess diesel NOx emissions in the current global vehicle fleet? And then how are those impacts divided among cars and trucks, and where are the impacts the greatest? We also wanted to know not just what is the current situation, but how can it be improved into the future? So how much of these impacts could be avoided in the future? Next slide, please. So I just wanted to give a brief overview of analytical steps before each of our co-authors give more detail on each of these. We started with in-use NOx emission factors, which is drawn from a review of over 30 in-use emission testing studies using PEMS, remote sensing, and other techniques. And then we combined those in-use NOx emission factors with activity level information, such as the number of vehicles and the average distance driven, to develop new in-use NOx emission inventories for the 11 markets included in our study. Using those emission inventories in a state-of-the-science global atmospheric model called GEOS-Chem, we're able to simulate the impacts of those emissions on ozone and particulate matter levels. And that global atmospheric model accounts for the various processes that affect concentrations of pollutants in the atmosphere, including meteorology and chemistry. And we also combined the information from the simulated concentration, the model simulations with satellite observations to be able to obtain exposure estimates at a pretty fine resolution on a global scale. Once we simulated the ozone and particulate matter levels, we combined those with established health, climate, and crop yield impact assessment models to estimate the societal impacts of the excess diesel NOx emissions. And each of my co-authors will go into more detail on each of these steps. So I won't say anything more about this here, but just wanted to give an overview of our analytical steps. Next slide, please. And I also wanted to give a brief preview of the policy implications for those of you who aren't able to stay on the webinar for the entirety of the period here. This gives you a sense of what we found. For heavy-duty trucks and buses, implementing Euro 6 standards just as is, where not yet adopted, is the key next step. Most of the health benefits from implementing next generation standards for heavy duty vehicles could be achieved just by implementing Euro 6 standards as is. For light duty vehicles, strong real driving emissions programs can make Euro 6 and similar standards more effective in real world driving. So in contrast to Euro 6 for heavy duty trucks and buses, Euro 6 for light-duty vehicles is not as effective under real-world driving conditions. And so we need strong real driving emissions programs, and those can actually be quite effective at reducing real-world NOx emissions. And then finally, adopting and enforcing next-generation standards, which are more stringent than the current Euro 6, could nearly eliminate real-world diesel NOx emissions and associated health impacts in these 11 markets. And you'll hear more about each of these policy implications from each of my co-authors, and we'll return to these policy implications at the end as well. Next slide, please. And before I hand it over to the next author, I wanted to just briefly acknowledge all of the team members here, some of whom you'll hear on the call today. Our support was provided by the Hewlett Foundation, the ClimateWorks Foundation, the European Climate Foundation, Energy Foundation China, and the NASA Health and Air Quality Applied Science team. And I also wanted to acknowledge the various experts in a variety of disciplines who we consulted for this work and provided input. So many thanks to the individuals listed here for their guidance and consultations. So I think now I will see if we have any questions, and then we can move on to the next speaker.
Okay, Susan, thanks for that. Good overview of the study as a whole. We'll be diving into each of the sort of specific aspects of the study next. But first, I wanted to take a question that we have gotten on real driving emissions. The question is whether the real driving emissions program is the same for all vehicle types, cars, vans, and HGVs, and if so, why? This may be a question that that Josh Miller, who led our emissions modeling and scenario development, might be better suited to answer, but I wanted to just get a first take from you, Susan, if you have a quick response to that one.
The question is whether real driving emissions programs in Europe apply to all different types of vehicle standards?
All different vehicle types.
Vehicle types, yeah. So I think this is a question that Josh can expand upon, but there is a difference between heavy-duty vehicles and light-duty vehicles. There is already some requirements for real driving emissions testing for heavy-duty vehicles, and those need to be, the real driving emissions programs need to be strengthened for light-duty vehicles. So there is some difference among vehicle types, and I think I'll let Josh expand upon that further.
Yeah. That sounds fine, and I think I'll make sure to bring that up again with Josh. And one other point, if you could just briefly speak about NO2, which I know is something that's of great interest in Europe. If you could respond to the question on whether this study assessed the health impacts of direct NO2 or not.
Right, that's a great question. We focused on the methodology used by the Global Burden of Disease study, which limits the analysis only to ozone and fine particulate matter, or PM2.5. And I'll speak about the health effects of NO2 in more detail during my session on the health impacts. But there is some evidence showing that direct exposure to NO2 also has a variety of health effects. And so as a result of our exclusion of the direct health effects of NO2, we think that our results might actually be underestimating the true health impacts of diesel NOx emissions.
Okay, great. I think that's all the time we have for questions. I'd like to move on to the next question, and we've been getting a few more that I think Josh will probably be pretty well suited to answer. So Well, thank you, Susan. We'll come back to you on the health impacts analysis later in the webinar.